Hello there and welcome to another episode of Discuss. I am your host, Priscilla Obasi, and today we're going to be talking about, the tragic death of the Abuja-based singer Ifunanya Nwangene that has sent shockwaves across the nation and raised urgent questions about our healthcare systems, particularly around emergency response, around access to life-saving treatments, and the readiness of our primary health care facilities. Now, let us start by understanding the recent situation. Mrs. Nwangene was bitten by a snake in her home, and she was rushed to seek treatment. She first visited a private clinic that did not have the required anti-venom. Then she later went to a tertiary hospital where emergency care was provided, but she later died from complications before receiving full treatment. Now, in response, the Federal Medical Center in Abuja has said its team acted promptly and administered anti-venom and other emergency interventions, but the venom's effects were already severe. Now, this tragedy has renewed public debate over our healthcare infrastructure, the availability of venom, anti-venom actually, and the strength of primary healthcare, and the broader weaknesses in our healthcare sector. We're not going to be doing this alone today. Of course, we need a professional to help us understand what is actually happening. Why this? Why wasn't she given the adequate treatment on time? What is wrong with our healthcare system? We're going to be joined on today's episode of Discuss by a pharmacist, and you'll get to see her after this break. Please don't go anywhere. All right, so joining us on today's episode of Discuss is a pharmacist. Yes, she is. Okay, can you join us on today's episode of Discuss is a pharmacist. She is here to help us unpack the story now from the perspective of both the pharmacist and the primary healthcare. She's a practicing pharmacist from the private primary healthcare clinic in Abuja, a member of the Pharmaceutical Society of Nigeria, and the secretary of the Association of Lady Pharmacists. You're welcome to the conversation, pharmacist Ifesita.
Thank you very much.
Thank you so much for joining us. I mean, who would we have done this with but a professional? So, pharmacist Ifoma Felicity.
Yes, thank you.
Okay, so ma'am, let us start by focusing directly on the incident that sparked this conversation. Now, the tragic death of Ifunanya, who was reportedly bitten by a snake and sought help at multiple medical facilities before she finally passed away. This is not just about the blame game now. It's about learning. We're trying to be accountable, creating a system of accountability and preventing future reoccurrences, preventing future deaths. Now, based on the information available, Ifunanya first went to a private clinic that did not have the anti-venom. From a medical standpoint, should any clinic receiving emergencies should be expected to stock life-saving drugs like anti-venoms?
It's actually an unfortunate incident, and my heart goes out to all her loved ones. Those left to mourn her. We pray that God grants her peace. Talking about emergency medication, there is no clinic, no hospital, whatever level it is, that is supposed to be out of emergency medication. And because of the position of Nigeria in the map. Nigeria is in the tropics, and there are lots of snakes, different species of snakes, and there is risk of snake bite. Anti-snake venoms are very essential medications that should be available in every hospital, every clinic, every healthcare center, especially in healthcare centers that should be readily accessible by people in both rural and urban areas. So it is very essential to always have these medications and beyond anti-snake venom. But since that is the focus of our conversation, there should be essential medications at all times, even if they are not fast moving. Because I want to assume that one of the reasons why a clinic, a healthcare facility would not have anti-snake venom present in their stock is because of the fact that it is not fast moving. You might stock and it gets expired, but it's better that it expires and you replace than not having it at all when it is needed by people. So it is very important that every healthcare facility has an anti-snake venom readily available, in addition to other essential medications that should be available.
Thank you so much, Fam Ifoma. Let's go to the next one. Now, if a facility lacks critical drug, what is the ethical and professional responsibility of that clinic in that moment?
A clinic, a healthcare facility, ethically is not supposed to be without essential medication.
Okay.
It's not supposed to be without anti-snake venom. When I was 7, when I was an NYSC pharmacist, the camp that I stayed in had anti-snake venom there, and the state coordinator was always saying that they have never had need for this, but it is a criteria. It's one of the criteria for the camp to be in operation. So if a temporary structure can have anti-snake venom because of emergency, accidents are never foreseen. Do you understand? They are never foreseen. So the ethical thing to do is to always have essential medication. It's just like saying a maternity ward does not have what is required for delivery. Then why is it there? So the only ethical thing, the professional responsibility of every clinic is to have basic items, basic medications, basic consumables that are needed to save life and prevent complications. But if unfortunately it is not, it should not be in the first place, then with immediate referral, and there are some management protocols that could be done. But in the case of snake bite, there's very little that can be done beyond administering anti-snake venom and other medications that might be needed in the course of treatment. So that is the ethical thing to do, and that is the professional thing to do. To know you are establishing a clinic or a hospital or a care center, these are things that should be available in your clinic. That is the only ethical thing to be done.
Okay, so let's talk about the real situation. Her brother came out to say that she took herself to the hospital. She tied the point where she got that, bite, and was able to pull herself to the hospital. He emphatically said that he spoke to her all through her journey to the hospital.
So after she was eating and trying to constrict, tie a tourniquet to the, tie a tourniquet to the, above the site of the injury, right?
Yes, and then she went to the hospital herself, and the facilities or the people in charge, then the doctors, the nurses, I don't know who they were, but they untied it without acting fast. So according to her, she had managed herself until they untied that, and that was the point the whole thing, escalated and led to her death. So was that the right thing to do at that point? Was she actually, I want to even know, was she given the anti-venom in the second hospital she visited?
from the information that I have and is in circulation, she was administered the antivenom at a tertiary facility. So, since she has visited other hospitals before she was transferred to the tertiary facility, a lot of time has passed. In the management of life, time is really of essence. And it's actually unfortunate that Nigeria doesn't have an emergency service. Because snake bite is something that is supposed to be treated urgently, either at a primary care facility or an ambulance is sent immediately within not more than 10 minutes to the location of the injury and critical care administered. Now, one thing, she applied the tourniquet. I do not want to make excuses for people, but I want to assume that it was removed for care to be administered, or maybe because she tied this too tight and blood flow was constricted. And one of the reasons why people need to learn how to tie the tourniquet to prevent to minimize blood flow is the fact that preventing blood flow entirely can lead to cell damage. So it can cause damage to the part that blood is not flowing to. Okay, so she moved around, and you will agree with me that movement actually increases blood circulation, and it's when there's blood circulation, the venom that is in the system that have gotten into the bloodstream is also moving around. It's not selectively moving. Okay, so it's a critical case that required urgent attention. That the patient is not supposed to be moving from point to point looking for care. Care is supposed to be brought to her, but she's supposed to get the care that she needed
at the first
place. At the first point of care. So one of the complications could have been due to the fact that she was very active, moving around. The tourniquet could not prevent the venom from entering into systemic circulation. Okay, and she did not get the anti-snake venom when it was needed. So because she's also had been administered an anti-snake venom within 20 minutes of that bite. So what is the distance between her place of residence to the first hospital? What time was taken there before she was referred to another? Till she was able to get to a hospital that had that anti-snake venom. So these are questions that need to be answered. And is it supposed to be so? No, it's not supposed to be so.
Okay, so thank you very much for that. I saw a video by a Proko doctor, Dr. Chinonso, and I want our viewers to just take a look at it, and then we'll come back to talk about what he said. Okay.
I'm sure you've heard the story about the lady who was bitten by a snake and she died, right? And it's a very sad story, especially when you think about it. But what if I tell you it's not the snake that killed her? I mean, snakes bite people everywhere. Whether you're in the bush, you're in the city, India, Australia, other countries, snake bite people everywhere, but they do not die like this. They do not die just because they went to two hospitals, not one, two separate hospitals, and they looked them straight in the eye and told them, we do not have antivenom in a country where snakes live in 2026. Not 1980, not 1970, 2026. And it has happened to somebody who is popular, but think about the other people it has been happening to that did not have anybody to report to, they didn't have any place to go, and they typically just lost their lives. Bright futures cut short. And when you think about it, if you even come to the research, Nigeria has a particular antivenom developed for Nigerian snakes. It's called Echitab. ECHITAB. The question is, why was this antivenom not in the fridges of the hospitals that she went to? Simply because we've forgotten the basics. Our politicians are building flyovers where ambulances don't exist. We're focusing on building ultra-modern hospitals when the primary healthcare center, which is the first point of call in any functioning country, should be. But rather than focus on those ones, they would rather want to do a big project, they'll cut ribbon, and everybody's going to clap for them simply because they're trying to focus on the next election rather than the lives of the people that they're actually supposed to save. We've forgotten the basics. In every primary healthcare center, the basic small hospital that's beside you should have antivenom. In a country where snakes live, they should have oxygen. They should have people who know what to do. We've been shouting about it. Doctors have been on strike for a while, but it seems nobody's talking about it because, it don't really concern me like that. No, it does. It does. But when doctors go on strike asking for better conditions, better services, even help us do our work better, the same people who are politicians find a way to put the people against the doctors and make the doctors the enemy rather than the people who are actually supposed to provide this healthcare for you. We've forgotten the basics. We've forgotten the basics. We're recently on a project where I've been going from state to state. The first one was Gombe, the next one was Enugu. I'll be going to other states in the country and we're going to be shouting, know your PHC. Take your phone, go to your PHC and demand it. Most times when we start, some of those projects, it's not healthcare. Person way chop. Person go first chop before he do healthcare. Now look at what's happening. This is just antivenom. How about the women who die from childbirth? See, and this is not just village people at work, because I see that some people have already turned the conversation into, it was a spiritual snake, it was this and it was this, and that's why our politicians are lucky people. Because they know that once they spin a particular story, everybody will run with it. Nobody's asking why does our hospitals don't have antivenoms? The money that was budgeted for the primary healthcare centers, why was it not supposed to do what it was supposed to do? But rather they are saying, he's a spiritual snake, he's a neighbor, he's jealous of our these things. That is how they keep us down. Well, we can do what we want to do. But what I will say is, when time comes to actually demand accountability for healthcare, if you hear budget allocation, don't just tune off. Ask, does my primary healthcare, we should stop praising audio projects when primary healthcare centers don't even have common paracetamol. Go to the pin post on my page and look at that. Those are primary healthcare centers that's actually supposed to help people survive. We failed this young lady today. We're failing others. It concerns all of us, and that's all I'll say. Thank you.
All right, that was from Aproko Doctor, popularly known on social media for his, health tips. Are you there with us from Ifoma?
Yes, I am.
Okay, so he emphasized the need for our primary health care to be restructured or to be, developed better than what we have right now. What would you say, what is the purpose or what is a primary health care? Let's even start with the basics.
Okay, so the primary health care, as the name implies, is usually, ideally, the first point of call for any healthcare issue. It is in situations where the health condition cannot be managed by the primary health care center, that is when it is referred to a secondary care facility, or a tertiary care facility based on tertiary. So the primary health care facilities are supposed to be in every nook and cranny of a community, be it a rural area or a semi-rural or urban area. Unfortunately, in Nigeria, we do not have very functional primary healthcare systems. And most of these primary healthcare systems that are available are below par. If you check the link that he asked at the end of the video for people to see, you will see that these primary health care centers do not even have facilities. We do not even have beds. And beyond the case of Ifunanya, there are a lot of cases that would have been handled promptly, but because there is no personnel, there is no facility, there is no medication, there is no equipment to handle those cases, people pass away. So a primary health care, I work in a primary health care facility in Abuja. So and it is modeled after what is available in developed countries. So I know the impact that a properly functioning primary health care center can impact the society. A primary health care center is supposed to be set in such a way that it's not going to take you up to 5 minutes drive to access one. Every community, every hamlet is supposed to have one primary health care center that has a doctor. It should be a GP. You have nurses, you have pharmacists, you have in Nigeria we use community health extension workers. Unfortunately, in most of these primary health care centers, you get to find only these community health extension workers, and there is limit to what their training can help them impact society with. So, apropos Dr. Daisam, Dr. Ogumba, he's correct in his outburst, I would call it that, because it's these are avoidable deaths. Why will someone have to go to a secondary care facility or tertiary care facility to get treated for malaria when we are supposed to have a primary health care facility equipped to do those things? I don't know if you get my point.
Sure.
It's very disheartening that we do not have. In fact, I have never used a primary health care center until I started working in my current premises. And I was surprised when I was employed and they told me that this is a primary health care facility. When it requires some care, we have to refer to partner facilities that offer secondary care. It's very important to build roads, it's very important to build flyovers, but the basics, education and health is very important. It is people that are alive that will use those other facilities. I don't agree that they are white elephant projects, but they are not necessary. They are very necessary. But our politicians, the government of this should put these basic things. I don't think it's going to cost a lot to manage the primary health care facility. I think we appreciate it more because when you are sick in the village, you go to the health care center that is close to you. If you cannot be managed there, you are referred. And there are referral protocols or channels that makes it easier for you to transition from a primary health care facility to secondary care. Otherwise, you're going to start from the scratch. So then having this primary health care facility will also help to reduce brain drain. Why I'm saying that is if people are employed, most of the reasons why people pass in quotes is because they don't have something to do, something meaningful to do. Unfortunately, currently in the country, some health workers are on strike. I am very aware that JST, which is the Joint Health Sector Union, has been on strike for more than 3 months.
Wow.
But why will the healthcare sector be having incident strikes? Why? It's not proper. If the doctors are not on strike, the pharmacists are on strike, the nurses are on strike. So, for things to work with, is this how we are going to continue? It's not proper that the health sector will be shut down. And the only way that people can access care is by going to private facilities that might be beyond their financial capacity or they are far away from there. So you have to travel and pray that nothing happens on your way to those locations. So we need our primary health care centers to be working, not just working optimally. When you go to other countries and you have to pass through the primary health care center before it should be determined if you need secondary care or tertiary care. And you do not understand why our primary health care centers are not working. It's not just about rural communities. This is an urban center.
Yeah.
You would agree with me that there are a lot of hospitals in the FCC.
Mm-hmm.
But where it was needed, something as little, I want to believe that if there was a primary health care center close to Isinanya, she would not have passed. She would have gotten jump scared. Or if there was an ambulance service, and she does not have another thing, accidents happen, you see people lifting people into the back of pickup trucks to move them to the hospital, or they are putting them in police vans or federal city vans. Where there's supposed to be ambulance services, ambulance for emergency. What's our emergency number? What is?
Do we even have one?
Emergency number, because they are not working. I'm sorry to say, it might be too late. So people have to be proactive about their life by moving themselves. So this is actually a call to the government to come to the aid of ordinary Nigerians by putting in place things that we need to survive. It is not to survive. It's not really to enjoy life. It's to survive.
It's not luxury. It's survival. Barest
minimum. It's not luxury. It's the barest minimum, for God's sake. So the government needs to do better by us. We understand that important project. But health is a more important project. Thank you.
Thank you very much for that. I want to talk about the coordination, synergy between private clinics and government clinics. Do you think we have a smooth coordination or synergy?
I wouldn't want to say we don't have a smooth synergy. However, because we don't have a central coordination of data and all that. You see, most times when patients are transferred from one facility, not just private facilities, I'm talking of government facilities to government facilities, you have to almost start afresh. You almost start with documentation, because there is no electronic medical record that cuts across all the facilities, that you can see where this doctor stopped, or where this pharmacy stopped, or where this care coordination stopped, and where to start with. So you see, you have to start doing patient documentation, patient identification, start asking about what has been done. So if the person is clueless or cannot give you that, we start afresh.
Most times, private hospitals would not even want to, government hospitals wouldn't want to take records, tests, lab results from private hospitals, and they would always, try to get them to start afresh. Is all of that necessary? Why the lack of trust?
That is actually the problem. I wouldn't say it's more of a trust issue. I think it's more of the fact that care coordination is poor. Care coordination is poor. So people want to be certain of what they are doing, and because they do not understand what has been done before, because most times it's just that synergy isn't structured. It isn't there. Okay, synergy is not there.
How about government hospitals having a list of private? Because most times I have been in a situation where I go to a government hospital and I'm required to run a test, but they tell me we only run this test on Thursdays, or we are scheduling you for next month, and you have me wait for 2 months. How about recommending a private hospital that I can walk into, run this thing, and give you the results? Why do I always say? Because the queue in the government hospitals, they're just so much. So is it not better to have a list of private hospitals that can be trusted? After all, these people have they work as HMOs to organizations, right? So how about that? Instead of asking people to go start from the scratch or wait for a process and life is at stake.
That's a question that should be very deep thought among us Nigerians. I understand that some facilities are not seen to be standard. So maybe based on experience with these private labs and private clinics, the facility that the patient is referred to or transferred to doesn't always agree with the findings, especially when there are conflicting findings. So you get a result from this lab and it's giving you a different results from what these other labs are doing. So we want to be double. So if Nigerian labs, hospitals, everywhere is standardized, then you know that you can trust results from these labs. You can trust care, the quality of care that was given from this lab. Like in the clinic I work, we have JCI accreditation, Joint Commission on Health. Okay, we have ISO, but our processes are validated. So the chances that you get a result from the lab in the clinic I work and you tender it somewhere and it's being queried, on what grounds are you querying it? There are labs like that in the FCT. I do not want to mention them, but there are lots of standard labs that offer good quality care. And when you get results from them, it should be accepted anywhere in the world, not just in Nigeria. So until these labs, these hospitals do what is essential for them to be regarded as a quality center that you can get quality care, I think that doubt, that mistrust, let me use that term, that mistrust will be there. And then apart from the fact that there is no clear channel of communication, it's just that fact that people don't believe that I can get the same results from lab B, or feel that they are fabricating results. So talking about transferring patients, it's not supposed to be difficult, because when you are transferring a patient from a facility to another, there's supposed to be communication between those facilities. You don't just send someone there. You can hear me, right?
Okay.
So I just feel we can do better by ourselves, by having relationship. It should not be a how am I going to put it? It's not supposed to be a conflict of interest something. Transferring the patient is because I cannot offer the care that this patient needs. So it is your responsibility, your professional duty. So accept the patient that is respect to your facility and do the most you can. If you cannot handle that patient, then you refer to a higher facility or a facility that you know. So there should be communication and synergy between health facilities. And if Nigerian health system is well coordinated, then we would have that synergy. At this point, we do not have that synergy between even government facilities. We do not have, because, for instance, the government hospitals are managed by the HSS, that's the Hospital Management Board of the FCT. I have a different card at Wuse, and I have a different card at Mechama. Unless things have changed, but the last time I assessed there in the Hospital, I have different card number in Wuse Hospital, and I have different card number at Mechama.
And all of which are government hospitals.
Yeah, these are government hospitals. So what I'm saying is, we should find a point where there is
synergy,
an electronic health record that cuts across facilities, so that transfer of patients can be seamless and care can be offered at the point that is needed.
I really think that is a big problem. Synergy. If we cannot even have synergy between government hospitals. For example, I remember when I was trying to have my second baby, I had my first child at a government hospital, and trying to go to another one, another facility out, it would require. I started my antenatal there. Why wasn't it easy? It wasn't just so easy from going from one hospital where I had the whole antenatal to another government hospital. I had to start the process again, the whole registration again and again. And if that can happen between government hospitals, how much more private, or government to a private, or private to government? In the case of Ifunanya, she first of all went to a private hospital. What stopped that hospital from by themselves looking for an anti-venom, instead of sending her again to travel to go and save herself? This is a hospital facility. If you can't handle it, can't you just keep that patient there? Call a government facility and tell them that you are in need of something and it will be given to you?
Okay. It is really an unfortunate situation, because in Ifunanya's case, God rest her soul, it's a time-bound situation. And there are some pharmacies in the FCC that I know that stock anti-snake venom. unless the private facility is saying that there is no pharmacy that is closed. And a lot of pharmacies don't want to stock these items because they are emergency medications and they are not fast moving. Most times, if you buy even two will get expired, you will stop, it's going to get expired because how many times in a year do you hear of snake bite incidents? I don't know if you understand.
Yeah, I do.
So it is actually wrong that a clinic, a hospital, did not have anti-snake venom. So that unfortunate situation has already happened. And was she the one that went? Why didn't they put her in amber, offer some care? Why they were transferring her to the tertiary hospital? Why did she have to be the one to go to the tertiary facility herself? So it is highly unfortunate, and it tells you how far behind our healthcare system is. It is really unfortunate. It's disheartening. I must be sincere. It's disheartening that something as basic as anti-snake venom is not available in a hospital, be it private or public hospital. These are things we have. We need to have them. It's just like saying, because you do not have a lot of people coming down with asthma attack in your location, so we are not going to have a nebulizing machine. Like a nebulizing case. So if they rush in somebody with such emergency case, the person is going to likely be at your God or pass away.
So in such a situation, who is held accountable? Are we not supposed to be holding someone accountable? I mean,
the whole system is held accountable. We cannot just single one person, that one person should take the responsibility. The private facility has the responsibility. The government has a responsibility, because if the government has put things in place, we wouldn't be having this conversation. The procurement person in the clinic is held accountable. I am a pharmacist. I have gone to a lot of private hospitals, and they do not have a single pharmacist. They do, even big hospitals, they do not have a single pharmacist. So who is determining what is an essential medication? Who is determining what should be stored? Who is determining how things should be stored? How things should be procured? Somebody that doesn't have the experience. I do not want to mention any profession or anybody that is doing this by most of these private facilities. And where the appropriate persons are not in position, things go wrong. Things go wrong. Somebody did not know that it is very important to have an anti-snake venom in the fridge at all times. In fact, you get the anti-snake venom. Some facilities you will go to, they have anti-snake venom, but they are not properly stored. There is a very high chance that if that is used on the patient, it will not work because it has degraded. Most anti-snake venoms are stored at a temperature of between 2 degrees centigrade to 8 degrees centigrade. That means it has to be in the refrigerator at all times. Now we'll come and talk about power supply in Nigeria. Some clinics, they close in the night because there is no light, and you cannot afford to be running generators when you are not expecting to see any patients in the night, or when it's only when the patient comes that you turn on the generator to attend to the patient. So you see, there are a lot of things. What is the staff strength of this private clinic? Do they have the right person? What is the level of their physicians? Do they have pharmacists? Do they have nurses? Do they have nurses that are trained in emergency care? Do they have these medications that are considered essential, but they are orphan drugs? Because orphan drugs are medications that are not, they are not, I don't know how to explain it. Let me try to explain it. Orphan medications are medications that are essential, but they do not have an economic base to stock. Anti-venom are orphan medications because it's not economically valuable to stock them. And are you praying for people to be beaten by snake? No, but these things happen. I need to have them. And the government, they have protocols for bringing in those medications that are considered to be orphan drugs, because So there are a lot of waivers for people to bring them in, to make them affordable and available too. Okay, so there are a lot of people that are supposed to have done something right. Even myself and you on this conversation, we're supposed to hold our politicians accountable, but we don't do that. We are easily distracted. By the time it's 2 weeks from now, everybody has forgotten and
moved on.
And we shout and wail. But we are the people that elected the people that are making these policies and the laws that are guiding us. Why don't we hold them accountable and tell them what we want? When was the last time that the representative of your constituency had a town hall meeting with the people that he or she is representing to know their actual needs? You will not sit somewhere and tell me that I need food when I do not have access to health care. So everybody has a share of blame in this unfortunate situation. And I just hope that this is a clarion call to our government and everybody, every policymaker, every individual to step up and understand that we want our country to work. We want Nigeria to work for us, for our children, for our parents, for our siblings. If we would have appreciated more if the country, the healthcare system worked out for her. So there's no particular person to be blamed. Everybody has a share in this. Thank you.
Thank you very much for that. Let's talk about pharmacists now. You are a pharmacist. Is it not okay that I walk into a pharmacy and get an anti-venom?
It is very rare. Pharmacists stock anti-venom, okay? But are the staff at the pharmacy level trained to administer this anti-venom? I know there has been an ongoing call by the Association of Community Pharmacists of Nigeria, ACPN, and Pharmaceutical Society of Nigeria at large, because that is the umbrella body of all pharmacists. So community pharmacies, that is these pharmacies that we work in to be certified as primary health care centers, as vaccination sites.
Yes.
Anti-snake venom can be said to be vaccines, but there are some technicalities in the administration. It is not administered like every other medication, okay? So somebody needs to be trained to be able to administer that. Somebody needs to be trained to be able to administer as little as paracetamol. Okay, so if pharmacies are accredited as vaccination sites, then they need to be training and retraining of the staff that will be responsible for administering every type of vaccine. In the FCT, for instance, there are some pharmacies that are already certified to administer vaccine. But I believe that the scope is still developing. So, because somebody might be trained on how to administer tetanus vaccine, but anti-snake venom has technicality. So you need to know the modalities for administering and what to do, at what point to refer when you have stabilized the patient and all that. So, she could have been able to get anti-snake venom from the pharmacy, but what about administration? You know what I asked previously? The staff in the private hospital, what is their level of training? Are they trained on how to administer those items? Because I went to the FCT and I hear all sorts of qualifications to work in the hospital. And I wonder who are in those hospitals, if they are being monitored and re-evaluated. Somebody that is not a nurse is employed as a nurse in a facility. What is the Ministry of Health doing in evaluating these hospitals that will give license to practice? Because somebody that is not a nurse cannot do the work of a nurse. The person will only do what within the limits of what he's trained at that moment to do. So, pharmacies stocking anti-venom, yes, some people do, even if they know that it might be a loss in the long run. And private pharmacies are not non-for-profit ventures. Okay. So, yes, everybody set up a business to make money and impact the society too. But you have to have the resources to pay your staff, to pay the rent of the shop if it's not yours, to procure, to store, to dispense. So at the moment, getting anti-snake venom in pharmacies is just to procure.
But we see drugs like birth control pills, what do they call it? Every other kind of contraceptives and all of that being sold by pharmacists. And even the very ones that are given in primary health care. So with exception to just this anti-snake venom, we see them. Is it basically because of the profits, the fact that it's not regularly used? Are they allowed to do this? And you are the professional here in the medical school or the pharmaceutical school. Doesn't do these things? This what do I call it? The medical field. Is a doctor not trained to do something that a pharmacist can do, and vice versa? Can a pharmacist, or is the pharmacist not trained to do what the doctor does? And the nurse, is there not some sort of synergy between these three professionals?
Okay, yes, there is a little synergy. However, the scope of training is different across fields. Okay, the pharmacist is trained differently to offer pharmaceutical care services. A nursing staff or a nurse is trained to offer nursing services, and a doctor. And there are different kind of practice. Even among the nurses, there are pediatric nurses, psychiatric nurses. So somebody is trained and develops himself more in an aspect. But there are the basic things. I know that in pharmacy school, in medical colleges, in nursing school, we are all taught pharmacology. Okay, so but the in-depth of pharmacology teaching for nursing is not going to be the same with the medical doctors, and it's not going to be the same with the pharmacy. But there's something that you should know a little about these people that are going to work as it, because unfortunately in Nigeria, most people in the healthcare system do not see the rivalry, which we are all aware of. There's rivalry between the doctors, and the pharmacists, and the nurses, and the
now that's rivalry.
And it's not supposed to be so.
The rivalry is something I think that is doing us more harm in Nigeria. I even heard that there is now a rivalry between public health experts, and all of that. They didn't go to school to study medicine and all. Why not, come together? Why not these professionals come together and bring in there? Because every profession is known for its own. There's an advantage with each, profession. Be you a medical doctor, a pharmacist, or even a nurse. So why the rivalry? Why?
The rivalry is actually doing us more harm. So I just hope that the younger generation of healthcare professionals will realize that we shouldn't be fighting ourselves. We shouldn't be fighting ourselves. Rather, the patient, even in medical school, in pharmacy school, we were taught that the patient is the center of healthcare. If the patient is not there, then your services are not needed. So why not everybody work together? Why not everybody work together to see that we have a better healthcare system, rather than having rivalries that are leading to industrial actions and all that unnecessary industrial actions? And the government should also do better to minimize all these inequalities that brings rancor among the healthcare team. I think if there is equity and fairness, then we don't want equality. It should be about equity and fairness.
So what?
We don't want it in Nigeria where every I used to say every market day, one team in the health sector is going on strike or threatening to go on strike. That is a warning strike, or it is a final strike, or down into totality. How can the health sector, the pharmacists are part of the health sector, right? The last scientists are part of the health sector. I know that the nursing council they pulled out, as the nursing and midwifery people they pulled out of the health sector. But there are other essential people that are currently in most hospitals. These are interns are the ones working. Interns are still in training. and you leave the pharmaceutical services, the lab services of an establishment in the hands of people that your main staff are still training. It doesn't make sense. It doesn't really make sense. It's really sad. I just hope that with this situation, as unfortunate as it is, it's going to be a wake-up call to everybody to do better.
Okay, finally, before we go, what should Nigerians know about what to do immediately after they, have such a scenario as a snake bite before reaching the hospital? What is the first aid for those watching this now?
Okay, because a lot of people don't know the difference between venomous snake and non-venomous snake, because not all snakes are venomous, and not all snakes have the same potency of toxins. There are some snakes that when they bite someone, it's just irritation. Okay, so if one cannot identify the type of snake that is the person, like what if Nanya did, God rest her soul, by applying a tourniquet above the bite mark, it's a good thing. It's standard protocol. But a lot of us are not skilled on basic first aid to watch the surface of the bite, go to the hospital. So things are done locally. It is in the local community. Tell you have a tourniquet, you have to use razor to cut the blade. We don't do all those things. So because of the fact that we are venomous creatures, the first thing is to apply a tourniquet and minimize movement of the affected area, because moving the affected area, that is the bite spot, increases blood flow, okay, and increases the chances of the venom going into systemic circulation. So it is very important that every care facility in Nigeria, not just in the US, every care facility has an anti-snake venom that is, tailored to the species of snake that we have here. Because one thing could be, yes, she was actually administered some anti-snake venom. Okay, but it's either it was too late, or the toxin profile of the snake that it had was not covered. Okay, so there are different brands of anti-snake venom. Okay, so whatever anti-snake venom that is tailored for sale in the Nigerian market should be stocked at every point in every care facility, so that when we have this system, somebody will not need to travel a long distance to access care. So if our primary health care centers are working, then we know that it's just to tie a tourniquet and rush the person to the available health facility, and the anti-snake venom is administered immediately, because we cannot take chances to assume if it's a poisonous snake or if it's not a poisonous snake.
All right.
If we have a functional health system, we would not have avoidable casualties.
All right.
And since this is my last word, I will just pray that God console with Nanya's family and friends, and touch the heart of our leaders and everybody involved to do better by us, so that we have a better country to call our own. Thank you very much.
Thank you so much. Say a big amen to that. I want to say thank you so much for coming on the program today. Your session has been insightful, educative, and just name it. Thank you, Ify, for being here with us. All right.
Thank you very much. It's a pleasure.
All right. And our viewers, remember, healthcare is not luxury. It is your right. Yes. First of all, it starts with you, right? And it's a reflection of how much we value each and every of our lives. So our nation, for it to move from point A to point B, of course, the health sector is one important sector that cannot be joked with. I have been your host on the program Discuss, and I want to say a very big thank you to our viewers for joining us on today's episode. We'll see you tomorrow again as we bring you updates and everything you need to know going on in the country. I'll say bye for now.